have been set out to us. During these sessions, we expect all the stakeholders and the participants to provide us with the challenges and to also provide us with the solutions to overcome these challenges, so that we can implement these budget announcements at the earliest. We can have a firmed up implementation strategy, and soon after the budget webinars, all of us in various ministries can come up with our action plans with timelines to achieve the objectives set out in the budget this year. And I once again request all to keep the basic spirit of this budget, that is fulfilling aspirations of people, Jan Akanshaon ki purti, and whatever we do is in tune with the demands of the country, demands of the industry, so that our youth can get enough opportunities and we can capitalize on their kuch karne ki jazba. I wish all the parallel sessions best wishes, and I hope that all of you join and actively participate. Thank you. So I think we can now join our parallel sessions. Thank you very much. Best wishes.
Good morning to all the panelists and participants. First of all, I would like to thank for joining this webinar. I am Rajat Seni, CEO and MD of National Industrial Corridor Development Corporation. Part of DPIIT, we are the lead equipment for this particular budget para. I would like to welcome a moderator. So today's moderator would be Saparna Somnathan, who is Practice Lead Health World Bank. Aparna ji, can you please respond? Am I audible?
You are audible. I can hear you very well. Thank you.
Thank you. Thank you. So, apart from Aparna, we have Shri Rajiv Topno as Principal Secretary, Health and Family Welfare from Gujarat. From Niti Aayog, we have Shri Rajiv Sen. From Ministry of Ayush, we have Director Morarji Desai National Institute of Yoga. Then from Health Fraternity, we have very, very respected people. We have Dr. Devi Shetty from Narayana Hridayalaya. We have Dr. Sangeeta Reddy from Apollo Group. We have Dr. Harsh Mahajan, who also represents FICCI over here. We have Dr. Upasana Arora, Mr. Joy Chakrabarti, Dr. S. Chandra Kumar, all representing CII. And we have Dr. Nagpal, who is lead health specialist from World Bank. And we have representation from Fortis and Max. We also have Director Strategy and Network Expansion Yashoda Group, Mr. Abhinav Gurkanti. And then we have convener of CII Kerala Ayurved panel, and he also represents Arya Vidyashala Kottakkal, Dr. P. M. Warrior. So as you can see, this is a very, very diverse panel and very respected names are here. So I would just go through the budget para and some basics that we thought that would be useful to set the context, and then I will hand over it to the moderator. Next. So it is to promote India as a hub for medical tourism services. I propose to launch a scheme to support states in establishing 5 regional medical hubs in partnership with the private sector. These hubs will serve as integrated healthcare complexes that combine medical, educational, and research facilities. They will have Ayush centers, medical value tourism facilitation centers, and infrastructure for diagnostics, post care, and rehabilitation. These hubs will provide diverse job opportunities for health professionals, including doctors and AHPs. Next. This, I think I have already covered the panel and the various groups that they represent. Next. This is next. So all of us over here are aware that India has emerged as a major provider of high quality and affordable healthcare services. We have patients from 100 plus countries, and this market is estimated at around US 10 to $12 billion. The specializations for which most of the patients come are cardiac, oncology, organ transplantation, orthopedics, neurosciences, and fertility treatment. And our hospitals in various metros are increasingly meeting global standards and accreditation benchmarks. Next. So our strengths, obviously, there is clinical capability. We have a huge base of skilled specialists as well as other health personals. Cost competitiveness, a huge medical education ecosystem. Honorable Prime Minister also pointed out. Then wellness and Ayush, and as well as the rapid progress in digital health platforms, and that has happened over last few years. Next. I think all of us today would be pondering on what should be the actual way ahead. And this slide will undergo a lot of changes. But there are still some principles like integrated planning. There's obviously the partnership for states for land, and another key partner would be the private sector. And this has been clearly brought out in the budget para also. Quality and accreditation and for international standards. Then the whole ecosystem where facilitation also needs to be done. And eventually the financing framework uh, in case by way of public-private partnership and as well as financial institution. So this is all from my side. I would now like Ms. Aparna to take over the session, and thank you so much.
Thank you for that.
And share.
Namaste. Good morning, everyone. Can you all hear me okay? Very good. Uh, thank you very much for that introduction. It's really an amazing group of people that we have together, both from the government and private sector today. The panel discussion today will focus on 4 broad thematic areas. The first thematic area is on the policy framework and institutional architecture for the medical regional hubs. The second thematic area is healthcare infrastructure and the clinical ecosystem that supports it. Third, the financing and investment. And finally, medical value tourism and patient services more broadly. So starting with the first thematic area of policy framework and the institutional architecture, I'd like to call on Shri Rajiv Topno, the Principal Secretary, Department of Health and Family Welfare in Gujarat. So, Mr. Topno, if I can turn to you with a question about the institutional and policy support from states for these integrated healthcare hubs. How can these hubs promote high-end skills and specialized training for, say, nurses and other health professionals, given that training and research are envisaged as part of these regional hubs? So over to you, Mr. Topno. Mr. Topno, we don't hear you. I don't know if you're able to unmute.
Well, am I audible now?
You are audible now. Thank you so
Right.
much. Please
So
go
much
ahead.
so in the virtual world, we have these glitches sometime. It's good to see you, Aparna. It's been long since we met, and it's been quite some time. But coming back straight to the question, I'll be absolutely very brief on this one. It all are aware of the advantages which a particular ecosystem offers, and to my mind, this kind of an approach of a hub and a medical hub kind of a thing gives you the benefits of collaboration as well as pushing the envelope and taking it a step further. And in terms of the policy framework, I would just essentially try to say that it ultimately depends a large amount on the will of the state. In the case of Gujarat, we have consciously tried to promote this particular thing, and the government has been quite proactive in sort of, building the ecosystem around core and adding on as we go ahead. And I'm happy to just share that this year we have also decided that we will sort of establish more medical hubs, two more in apart from what is there in Ahmedabad. And sum and substance is only this much, that it requires a lot of political intent as well as bureaucratic foresight, and the two need to collaborate together to get it done. So that's about it. That's what I had to say as of now. And of course, others are free to jump in. Thanks.
Thank you for that. We'll probably come back to you a bit later, but very well understood. So moving on to Mr. Rajiv Sen, the Senior Economic Advisor from Niti Aayog. So Mr. Sen, if you could highlight Niti Aayog's strategic work in conceptualizing and advancing the regional medical hubs as anchors for India's medical value travel and integrated healthcare delivery. Can you tell us a little bit about the work?
Very good morning, and thank you for inviting me in this panel. So what I'm going to do is, we have done a work and we have come out with a status paper where we work with FICCI and EY to come out of the model of what a hub should look like. So I will just in brief give a few highlights of what should be a hub, what should be a health hub rather, what should be its components, how should it be, how should the states bid for it, what are the things that should be looked into before assigning the hub to a particular state or to a particular region. Third would be the financial part, and fourth, of course, is the monitoring and of the project. So let me at the very beginning say that the medical that we are looking for is neither only hospitals or research centers, nor only Ayush related centers, nor tourist related facilities to be provided for, but an integrated whole of all the things properly built into a vibrant ecosystem. So I think first we need to understand what should be a hub, what can be called a hub. So all these things, it has to have high-end hospitals, it has to have high-end research, it has to have Ayush and wellness centers for well-being recuperative facilities. It has to have places for the faculty and skilled labor to come and stay. It has to have very well connectivity so that people from all over the world can fly into these places, and of course the basic infrastructure. So only when we have all the things can we, in our model what we have developed, call it a medical hub. And I'm sure when many states have already ventured into this, some states are already advanced, but there are many other states which are aspiring to set up such hubs. Now, in Niti, we have also worked with what we call the city economic regions. Different vertical is working on that. And it would be a good idea to look at these CERs and see which are the areas where a medical hub can fit in. Now, just to give you an example, we also have, as Honorable Prime Minister said, we have the education university hubs. So maybe when a CER is developed in a particular state, in a particular region, they might think that the endowments that they have is fit to set up a medical hub. So like that, the entire concept of hub is, first, it should be an integrated and coordinated whole in itself, having the facilities which I mentioned. Secondly, it should also fit into a larger, economic region development plan by the states or, by the UTs. These two, I think, are the overall factors that should decide how and where to set up a hub. Secondly, coming to the requirements in the sense of area and all. So I think a minimum area is of course required. This will be an activity which will be spread over many things. So just one second. I am not going into the specificities of the area, but of course it has to be quite big. Now, what are the, how, again, as I said, how do you, because, since the budget says that 5 such hubs are to be set up in the states, what would be the prerequisite? So we should, while setting or while allocating a hub to a particular area, we should again look at the existing endowments that the area has in terms of manpower, in terms of connectivity, in terms of the facilities that are already existing, or there are plans for those facilities in that area. So I think these are again very what in short we call a challenge mode. So I think it's very important for the central government or for the state government to choose the right spots, to choose the right places to set up these hubs. Because if we set it up in a place where we are not able to get all the required endowments and the facilities, I don't think that hub will be successful. So having first having highlighted the components, and second, what are the prerequisites, I am not going into the details. There are many, of course, connectivity being one, and the others which are very well laid out in the paper that we have prepared. Third would be the financial pattern. Now, obviously, this cannot be only a government effort, because the cost would be very high. It has to have the participation of the sector, both in terms of financing and management. First, I'll come to the financing part. So what it should ideally be is that the government will maybe provide, the state government will provide the land and set up the basic facilities. In a plug and play model, when we talk of, we have certain basic facilities that are to be provided. So maybe government financing can be used for this. And then the rest, like setting up of hospitals, setting up of state of art research centers, setting of hotels, all other amenities that are required should come in either fully or majorly from the private sector. So again, here, that's why I'm saying it's very important to choose the location and the prerequisite, so that private sector gets interested and they come in and they are ready to provide or ready to invest in such a facility. Because otherwise, if it is only government, it is not going to succeed, and obviously government will not be able to provide for the entire facilities that are required. Now, how does this financing and entire activities happen? For that, I think that we should set up what is called an SPV, comprising the state, the private sector, and other stakeholders who would be managing and running the day-to-day activities. All financing should be routed through this vehicle, whether it is from the center or from the state or from the private units. And of course, there should be fixed KPIs that should be set up. At the end of the day, what is the purpose of setting up these hubs? There are 3-4 very major outcomes that we are looking from. One, of course, is to develop skilled workforce, not only for the hubs, not only for the country, but for the entire world. Second, of course, is state-of-art medical facilities, which is obviously, you have hospitals, some may be JCI certified hospitals. Third is to, employment in the hub. As you know, when it's set up and when we have a lot of facilities, we will require skilled manpower. The skilling will be done there, and the absorption of a large portion of the manpower will also be in the hub. And there will, of course, be what you call multiplier effects, which would flow beyond the hubs in the nearby areas. We will have better manpower, better medical facilities. And these are things which will definitely develop once we have the hub in place. So I think in the first round, these are I just wanted to lay down what should the contours of the hub and how it should be managed. If there are any further questions, I'll come back later. Thank you. Aparna ji, you are on mute.
Here I am again. Thank you very much for that. Thank you for highlighting the integrated nature of these hubs and the importance of thinking ahead about the financing arrangements, what allocations are to be made for that, and so on. Thank you. So moving on to our next speaker, who is Dr. Kashinath Samagandhi, Director for the Moraji Desai National Institute of Yoga. If you could talk to us a little bit, Dr. Samagandhi, about the global best practices from leading medical tourism destinations, such as Thailand and Malaysia, that India should selectively adopt for an Ayush-centric medical tourism model. Dr. Samagandhi, are you able to unmute? We don't hear you speak. Trying again. Dr. Samagandhi?
Aparna ji, can we move on to the next speaker and then maybe we can
Yes.
come back to
Come back.
again? Yeah.
Very good. Thanks. So we're moving on to the next area of our consultation today, which is basically the healthcare infrastructure and the clinical ecosystem. So for this section, calling first on Dr. Devi Shetty, the founder and chairman of Narayana Health. Dr. Shetty, we would like to ask you a little bit about innovative models in healthcare delivery to improve access and efficiency. How, in your view, would high volume uni specialty centers of excellence ensure economic returns to investors while catering to multiple customer segments? Over to you, Dr. Shetty.
Thank you, Aparna. Thanks a lot for the opportunity. First of all, I would like to congratulate our government for having the foresight to create a medical hub or a medicity predominantly to help the medical tourism growth of our country. It's an amazing thought, and I'm sure it will be a great success. We in India have gone from being a low-cost, affordable healthcare destination to become a cutting-edge, advanced care for the deserving patient coming from foreign countries. For example, we have become a center of excellence now in India. India has become a center of excellence for advanced treatment in cancer like CAR T cell therapy and other areas. From the cardiac point of view, we were doing cardiac surgery at affordable rate. Today, our institution, especially where I am working now, has emerged as the largest center performing the largest number of robotic surgery in the world, as recognized by Da Vinci, which is the robotic surgery company. So this is the growth we have seen. And today, world is waiting for innovations in healthcare delivery coming from India, compared to an era when all of us went to US or Europe to learn the art of cardiac surgery. It's an amazing journey we have seen happening. Now, when we are talking about the medical hub, mainly to cater to the foreign patients, it is very, very important for us to understand that these the destinations for medical tourism called Medicity should be predominantly offering healthcare to the locals, because that is the one which will make the hospital very vibrant. And medical tourism is a icing on the cake. So this is the way most hospitals across the world have grown to become a medical tourism destination. So to attract the local patients, if these medicities are located on the outskirts of the city because of the requirement of large plots of land, that may be far away from the locals to avail the services. This is very important aspect we have to look at. The other advice suggestion I have is that if there are going to be 4 or 5 hospitals, common services should be centralized. There is no point in having 5 hospitals having 5 blood banks or 5 hospitals having 5 laboratories to do all the tests. These, all of them can be combined, owned by all this group of hospitals who are practicing. India has not done a great job in marketing the quality of healthcare which is provided in the country in the Western media. Like if you open any of the international magazines, there are 2-3 full page articles about advances in cardiac surgery happening in Singapore. Now, what Singapore does in the whole country in a month, that the number of surgeries are done in some of our hospitals in India in one hospital. That is the volume we handle, that is the expertise we have, and unfortunately, this is not highlighted in the Western media. And individual hospitals will not be able to spend that kind of money for getting the attention of the medical tourists. It is very important that the government steps in to create an awareness about the advances of healthcare services what is available in India. We need to have a single portal for educating and giving the information to the medical tourists. We do have a portal, but we haven't been able to attract that kind of a footfall to that portal. It is very important. We have to make it more powerful, and also this will be a strong avenue for the foreign tourists to get the exact information about what is the quality of care available in India, bypassing the agents who, some of them may not be having a high degree of integrity, which ruins the reputation of healthcare in India. The other aspect what we need to look at is a tourist visa for anybody coming to India may be costing $10, but medical visa costs between $80 to $100. Whereas a large number of our competitors for medical tourism in Asia charge $20 or $30 for a medical visa. So it's very important for us to really bring down the cost of medical visa, same as the tourist visa. That will, because if 3-4 family members are traveling with the patient, it becomes a significant cost factor. It's very important that the visa time has to be reduced as much as possible, because when a patient in Africa or any of the European countries decides to come to India, they will always send the medical reports to multiple countries, and whichever country comes forward and gives them the visa at the earliest, that is the country they choose. So coming back to the ground realities happening in Indian healthcare, we have done an amazing job in addressing all the bottlenecks in delivering healthcare to 1.4 billion people. I will give an example. It took us 60 years to create 55,000 medical seats. And our government, our current government, has added 75,000 additional medical seats in just 10 years. This is unthinkable. And there is a attempt to create another 75,000 additional medical seats in the next 5 years. And this is remarkable compared to any other country in the world. We are forced to do this because an American doctor will never work in England, and an English doctor will never work in America. But an Indian doctor is happy to work in any of those countries. So it is a matter of time before there will be a desperate shortage of doctors, nurses, technicians in all the rich countries. And the first thing they will do is to relax the norms for an Indian doctor to practice in those countries. And when the floodgate opens, we will find it very difficult to hold on to our doctors. So our government has the foresight to anticipate this and look at the global requirement of a healthcare manpower and take necessary action. Now, coming back to the beds, doctors we have addressed, nurses we are addressing. Coming back to the beds, post-COVID, fortunately, with the massive investment healthcare industry has done, today, in at least in the major cities, we have adequate number of beds. I can confidently say that the number of beds available in city like is almost as much as in most of the European cities. And this was a major achievement. Our biggest problem is 70% of our population do not have the financial ability to enter a private hospital. This has to be addressed. We need to create an affordable health insurance for 400 million informal sector employees like gig workers, domestic helps. And this is a very important need. And the entire concept of delivering health insurance should change. Only when our Indian patients have adequate supply of healthcare, we will be able to become leaders in medical tourism. And that can only happen with the affordable, low-cost health insurance with a premium as low as 10 rupees per day or 30 rupees per day. And believe me, with the tiny amount of 10 rupees per day, it is possible to cover the person for 3 lakh rupees with the insurance. So this is what we have to achieve to reach a stage wherein within the next 5 years, I believe that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. I am extremely grateful to you for giving me this opportunity. Thank you.
Thank you, Dr. Shetty. Very wise words about improving access to high-value medical services for all citizens, in addition to medical value travel. We will now move on to Dr. Sangeeta Reddy. Given your experience with large hospital networks in India, can you talk about the role of large hospital networks in strengthening India's global healthcare positioning? And how can these regional medical hubs that we're talking about today boost specialty infrastructure to cater to domestic as well as global demand? Dr. Reddy?
Yeah, thank you, Aparna. Namaste. Very happy to see all of you. It's a pleasure to be talking about this. The vision and the potential for the concept of Heal in India, which actually, we have all spoken about this as medical value travel for the last 20 years. We've been working on this. Approximately 2 years ago, our chairman, my father, Dr. Reddy, and the Honorable Prime Minister came together with this concept, and Honorable Prime Minister very powerfully said, I want this to be called Heal in India. And I think it is important. It is the beginning of healthcare being looked at not as a cost center, but a socio-economic engine and a global value creator. And that, I think, is the first step. The second thing is that I'm very happy to hear about the 5 hubs. I will quickly share that about 20 years ago, we took one of our single hospitals and transformed them into a health city. So the health city entails high-end multi-speciality hospital with separate 5 major sub-departments. It also encompasses on the same campus a medical college, so that you have the capability to treat. So that's a larger general hospital, but the same clinicians go both places. This gives you volume and skill enhancement. We also have a skill training center, including robotic training, etc. In addition to that, there is research, innovation, the accommodation for facility for international patients is something we did not have the place to do, but we have partnered with various guest houses, but that's a critical element. So I can later send a document which entails all the structural requirements of a hub or a single medical city. And I think the hub is a beautiful idea. I will reiterate, the aspect that we need to carefully plan what are the overlapping facilities. For example, if we do a single proton can cater across to all. If we do a PET CT, do we do a central diagnostic hub? Or do we do some things get distributed, some are centralized? So this is some serious planning, but we should go ahead and do it. Having this opportunity, I also want to highlight that, number one, the medical hubs and the medical cities can definitely become very powerful engines. The additional aspect of juxtapositioning them with Ayush and with alternate medicine with research on campus gives us an opportunity to do another thing that we are currently working on, which is to validate Ayurvedic treatments with allopathic diagnostics so that we can publish and present them to the world as in a language that the world understands. So I think this will then create a non-linear acceleration of allopathic and other methodologies, of Ayurvedic and other methodologies, bringing a further impetus for people to come into India. Today, they do allopathic care and think of Ayurveda as a rejuvenation or an adjunct treatment. We must highlight and separate where they can be the primary core treatment, and in some their rejuvenation. So this coming together, I believe, is a very powerful thing. The third point I want to make is that any of these done well will, at the best speed, take a minimum of 3 to 5 years to establish. Whereas today you already have current good medical hubs. So my request is that we first, in parallel, rejuvenate the existing networks that we have through some of the points mentioned. Dr. Shetty, all of us have been speaking about this. Vicky is here. Many of us, have been this thing. But the portal, I request that one government entity please take up the portal and help us, or give this to some non-aligned party so that it can be powerfully positioned with an appropriate budget, which was actually announced in the last budget. The second thing is that I think that the e-visa, speed of visa is one thing, but actually our competition like Turkey and Thailand have visa on arrival. So we have a comparative study of what is happening in other countries, what should be our differentiator. We need to come together as a team and say that we will be in clinical care across our ecosystem, not just at Apollo Hospital, but many of the other hospitals doing high-end care at 1/10 of global prices. How do we present this to the world effectively? How do we facilitate patients to come in easily? How do we make their stay, not just their medical stay, but the rest of their journey, the best possible, so that becomes a differentiation? And how do we enable accountability for those who are projecting the country's name? So the quality, the outcome, the cost, the reliability, all become something that we are assuring. This is a critical aspect for us to be able to present this to the world and to continue to grow. Finally, I do want to add, there are many other speakers, all of us have this thing, so I don't want to take up too much time. But I do want to add this aspect of that the governance of this of this city. I heard some aspects of all finances coming in together. I request that we need to find existing models where maybe infrastructure together, but the operating mechanism is an individual balance sheet, so that people have the incentive to come in, because sometimes they may not want to put in their money in a large combined ecosystem. So maybe I didn't understand the point entirely, but I believe this needs further discussion. I just wanted to flag that. The last point I'd like to make is the entire aspect of skilling. I began with the aspect of saying that healthcare is now to be viewed not only as not as a cost center, but a socio-economic and powerful medical diplomatic engine. In the socio-economic, the skilling is a very big area. And I know the World Bank is doing considerable work. My sister is on that committee. So here also, we'd be very happy to submit a separate paper on the immediate requirements in terms of accreditation of courses. Our medical has now done tremendously. The postgraduate medical for doctors has done very well. The number of nurses has increased, but the subspecialization in nursing is one area, and the paramedic training and skilling is a huge area that needs work. in conjunction with the aspect of recognition of those degrees. My final point is when the year 2000 came, IT engineers from across the world could work anywhere, and Indian engineers did a lot. When we saw the pandemic in the year 2020, we were bound by so many inter-country barriers in terms of recognition of degrees. My request is that the time has come for a certain level of global recognition of skills and capability with a simpler examination system, because right now that is one of the most difficult barriers to overcome. And the world is losing skilled medical capability because of some of these artificial barriers. We began, along with the Macquarie University, what I believe is the world's first multi-country medical degree. They do 2 years in Australia, 1 year at Apollo Hospital, Hyderabad, 1 year in Texas, and then back to Macquarie. If we as a government could encourage a lot more of these, considering the geopolitical disruptions, the visa problems, the cost of living abroad, if there could be a more dynamic push towards global degrees, it may be a transformational step for the next thing. So our first one is heal in India. The second is heal by India, which is Indians going all over the world to heal. And the third potential is heal from India, which is remote care. All of these has a tremendous opportunity. We're already doing some work in some countries in that area as well through our IT teams and our clinical teams. But I thank everybody who's put this together. I just want to say that we're very happy to share further thoughts, to collaborate in any manner, to invest and to participate. Thank you very much. Namaste.
Thank you, Dr. Reddy. I think hearing from all of the speakers so far, there's an incredible amount of knowledge and understanding of what these medical hubs should look like, right? All of you have so many excellent ideas. Some of you have papers on it. So I think in taking this forward, the government of India is quite fortunate in that they have so many people whose expertise to tap into. I'd like to check if Dr.
I'm sorry, ma'am. I want to say just one more thing.
Yes.
Which is based on the experience we've had over the last 20 years of patients from 104 countries. We can cull out, we do approximately, I believe, 10% of the high-end care, but we also do 10% of the medical value travel coming in for allopathic care, not Ayurveda or wellness. We can give you the problems, the aspirations of international, the markets which would come to us if we were connected better, and where we can make a difference in terms of global networking. So I will divide this separately and share these as well as deemed fit. Thank you.
Thank you so much. That sounds incredibly helpful. I'd like to check on Dr. Samagandhi,
Yes,
whom
I'm
we
here.
missed earlier.
Am I audible?
Very good. You are audible. Would you like me to repeat the question? Are you happy to?
Yes, please. If you don't mind, please repeat me. Repeat the
Sure.
question, please.
Sorry, just give me a moment.
You are not audible. Aparna ji, please unmute yourself.
Yes. Can you, sorry about that. Can you talk to us a little bit about global best practices, particularly, say, Malaysia, from Thailand, on Ayush-centric medical value travel? Thank you.
Yes. Pardon me for a technical glitch. First of all, I would like to extend my heartfelt gratitude on the behalf of Ministry of Ayush, Morarji Desai, National Institute of Yoga, for giving me opportunity to share my views in post-budget webinar. So as you asked that what are the selective methodologies or selective practices from the other country where they are already with the robust medical value travel facilities. So before that, we need to understand who are the global leader in medical value travel. As you suggested, it's like Southeast Asia, East Asia, or southern part of Asia, if you think. Ultimately, Singapore, as you stated, Singapore, Thailand, Malaysia, and even no doubt India and Indonesia, Bali. So these are all some of the global leaders in medical value travel, and the best practices which we need to adopt from these leaders are like, one is what I feel is that that integrating integrating the healthcare and wellness services along with the robust tourism policy. So when we see certain countries, preferably like Thailand and Malaysia, so they have a national policy, dedicated national policies, which is integrating with the health services and with tourism promotion. So here, no doubt in India, we have an integration with the ministerial integrations, like integrating with the Ministry of Health and Family Welfare, integrating with the Ministry of Tourism we have. But even we need to have a robust, dedicated government-led medical tourism promotional boards or promotional agencies. So this will be the one of the selective or intake from other leaders, and international accreditation and quality assurance. So whatever the services, whether it is a healthcare service or wellness service, or it may be any product we are catering to the any needy person, ultimately we need to come up with the international standards for everything. So here, when we see some other countries, preferably Singapore, so they have a different, and they have an international commission, joint international committee, which says that it's internationally accepted. So in such a way, no doubt in India, we have lots of accreditation services, like preferably when we think about the services provided by the hospitals, wellness center, or any educational institute, we have certain what we call regulatory organizations which preferably check the accreditations, like it may be a National Accreditation Board for hospital, for NABH accredited hospitals, wellness center, and NABL, and National Accreditation Board for laboratories, even investigations, whatever we are doing it. If it has a national accreditations, then obviously acceptance will be more. And even for any kind of manufacturing products, like we have like general manufacturer guidelines and GMP. So GMP again, it gives, like, it also states that okay, it is one of the accredited, well accepted, regulated products. And even under the BIS, even I'm basically from like yoga. So here we are able to come up with some products, standard products under BIS. It may be the yoga mat, it may be the threads which are used for the cleansing procedures, or it may be the cloth which is used for the cleansing procedures. In the same way, even for Ayurveda, like that, there are numerous BAS is working to come up with the standards for all the materials which are used for treatments or any patient care. So in such a way, if we enhance again, rather than sticking to the national level, if you enhance to the international standards, then obviously acceptance from the international health seekers will be more. This is what we need to even emphasize here. And one-stop medical tourism facilities. One-stop medical tourism facilities in the sense, so we need to have we need to strengthen Ayush visa with centralized facilitation service, and that is facilitation services in the sense, in one point, each and everything. So what are the documents required for the visa applications, and which are the hospitals they are supposed to choose, which are the services they are supposed to choose. If we have a robust MVT portal, obviously it will also facilitate. So many countries have their robust this mechanism, one-stop medical tourism facilities, so that we can incorporate. And even global marketing and branding strategy. When we see certain what we call like a global leader in MVT, preferably like South Korea, they have robust branding facilities. So they branded their MVT at the international platform. In the same way, Ayush, if we come up with the branding campaign which highlights the Indian heritage in Indian heritage, preferably Ayurveda, Yoga, or Savarikpa, like that. So that global level branding also helps to grab the attention of the foreign health seekers, and even hospital and hotel integrated infrastructure. Because when we say hospital, preferably when it is a government-led hospital, most of the we have a different scenario in the mind. So there won't be any facilities, there won't be any good infrastructure. See, that like of thoughts will be there. Rather than that, if we come up with these regional hubs, if we prepare these regional hubs in a like a resort way, if it looks like a retreat center, if it look like a resort center, obviously even this will also what grab the attention of many people. So even we need to come up with the integrated approach with the hospital as well as hotel integrations. So this will again helps to grab the attention, and even dedicated fast track specific longer visa facilities. No doubt, already in the year 2023, Ministry of Ayush come up with the Ayush, offering the Ayush visa, and data says that nearly more than in the year 2023-24, more than like 350 plus Ayush visas are provided to the health seeker, foreign health seekers. But if there is a fast track and e visa facilities, obviously this will also helps to grab the attention. And international international patient facilitating service. So it may be like focusing on the language. So facilitation should be something like that. Not only when the patients or health seeker visit, after visiting the hub, it will happen, but facilitation should happen from when they apply for the any visa thing. From there itself, facilitation should be in the, even from the from their boarding from their country, and even when they land in the India, even in the airports, there should be a facilitating center who will be able to communicate the things in their language. From there again, lifting them to the particular regional hub. So in one-to-one, when this kind of facility will be there, this will help to robust the MVT. These kind of things already there in the numerous leading centers. And another very thing which is literally we need to robust is that digital medical tourism platform. So especially Malaysia and Singapore has a robust digital medical tourism platform, and this will help us if we start making this robust. This will help to identify which kind of treatments or which kind of facilities public international health seekers are accepting. So we can come up with the data, we can prepare the infrastructure, we can prepare the like a specialist among specialists for the particular so digital medical tourism platform, if it is a robust, then obviously we can enhance our infrastructure, we can enhance our technical manpower. So this kind of digital medical tourism platform enhancing, and even skilled workforce and specialized training. Obviously, we are all focusing that. So in our budget, Ayush budget, even there is a more scope for the uplifting or skilling the medical doctors, skilling the paramedicals, skilling all the service provider. So skilling, ultimately skill timely, we need to skill the doctors, because whatever the expectations we are getting from the foreign health seekers, accordingly, if there is a requirement of any surgery, if there is any requirement of certain treatments, especially panchakarma, if there is any treatment requirement of any parasurgical components, like it may be the kshara karma, agni karma, marma therapy, and when it comes to the yoga, if there is any requirement of yoga specialist, one-to-one patient-based yoga therapy, so accordingly we can fill up all the existing medical manpower. So when they are skilled, ultimately they will be able to extend the ultimate services to the needy person. So in such a way, these are some of the component. What, and very last but not the least is the insurance partnership, partnership, because ultimately whenever the public or whenever the health seeker come for any kind of treatment, again he will see that is there any insurance policies which will reimburse the claims. So at that time, no doubt, even Ayush Ministry has integrated with the more than 27 insurance companies, which is offering more than 140 policies which are related to the Ayush facilities. It may be the Ayurveda or it may be the Yoga. So even we need to enhance this number of insurance companies. And when we see the data of incoming foreign patients in the year 2020, like nearly 1,60,000 people came to India for the health and wellness and even for the treatment. And same thing after 4 to 5 years, it rose up to the 6,40,000. It indicates that already there is a huge flow of the foreign patients for the treatment, and this preferably happening because of the robust private agencies or private health providers. So even our budget also emphasizes that even we need to incorporate the government services in partnering with the private stakeholders. So with private agencies, if we collaborate, obviously again many, because not only we need to limit it to the few private agencies or private health organizations. There are numerous health organizations. When you speak about the yoga, so you can Rishikesh, you can see that we are numerous. We have numerous yoga institutes which are providing the quality education, which are providing the quality patient care as well as therapeutic activities. In the same way, if you focus on the yoga, Ayurveda, so especially Kerala, in Kerala there are numerous private agencies which are providing very robust treatment and facilities. So if we enhance this kind of
Samakandi, if I could
collaborations,
to be brief, I mean, you're providing a lot of really good examples, but maybe they can come in a little later.
This is what exactly I want to say, which kind of things we need to incorporate.
Yeah. So, and I request the panelists also if they can be brief, because there are many esteemed guests who have joined the panel. Yeah.
So these are all the things what exactly I want to say, sir. Thank you, and sorry for extending things.
Thank you, Dr. Samagandi. Before I move on to the other speakers, I want to ask Mr. Topno, who was very brief earlier on, if you'd like to come in on anything, or Dr. Shetty and Dr. Reddy, I understand you might have to leave soon. Is there anything you'd like to come in on at this stage before we move on? Doesn't look like it, so we might.
I'm also a bit pressed for time because we have our assembly session on, but I'll see how much I can continue.
All right. So moving on to speaker, I'd like to call on Dr. S. Chandrakumar, Chairman, CII Southern Region Healthcare Panel, and the founder and executive chairman of Kaveri Hospitals. Dr. Chandrakumar, could you talk to us a little bit about opportunities for advanced healthcare development in Tier 2 cities?
Yeah, thank you. Thank you very much for giving me this opportunity. I think unlike the previous speakers, I'm going to tangentially talk something different. Before I speak about, I'll give a small brief about my background. The first 2 decades, I lived in a rural part of India, in South Tamil Nadu. The 3rd, 4th, 5th decade, the last 3 decades, I am living and established a hospital chain from a Tier 2 city. Okay, we have now 4 hospitals in Tier 2 and Tier 3 cities, and we are also building another 6 hospitals in Tier 2 and 3 cities of South India. So we started 2 decades back, and in the initial period, we were struggling to get specialists, okay, and also trying to difficult in financial resources. The last year till today, that is till March 8th, we have done this year in 1 hospital in Tirupalli, we have done 6,000 cardiac interventional procedures with this diagnostics and the therapeutic. We have done around nearly 1,000 cardiac surgeries, 150 kidney transplants. We have done around 30 liver transplants. We did around 20 bone marrow transplants. We have a 60-bedded NICU, and the district government recommends our hospital for any complicated high-risk pregnancies or NICUs. I think that's what we have done the last 2 years. I feel it will be appropriate to really talk about what the Tier 2 cities of India gives the opportunity. So when I say that 2 decades back, all these patients were traveling to cities like Chennai or to Bangalore or Hyderabad. But today, most of the patients we are able to treat in these cities. It means that demand already exists. Okay, either people didn't choose the opportunities or they are all traveling outside. I think the first point what I want to stress, the demand in a tier 2 city already exists. We can retain the patients who are going to a larger cities in those cities. The other one is a significant cost advantage. If you have to tell our statistics, we have 2 hospitals in a metro, and the price in those cities in the tier 2 is 50%. Okay. What the charge in a tier 2 is 50% of the tier 1. I mean, it's our own comparative statistics. Particularly is the land cost is low, the operating cost is low, probably the cost of living is also low. I think this puts the thrust on, should we do it in a metro or should we do tier 2? I would recommend we should do the hub in tier 2. I also agree, Dr. Devi Shetty, he said it's the hubs cannot be built for international patients. It should be largely for domestic patients. Then international patients will start coming. Also, Sangeeta madam talked about it will take 3 to 4 years. But to set up, it will take 3-4 years, but it takes 10 years for us to mature. I think that also we should keep that in mind. And once we establish these hubs in the tier 2 cities, it will also reduce the pressure of the metro hospital. They are saturated. We can also decentralize the tertiary and the quaternary care to tier 2 cities. It will be at a significantly lower cost. There are certain challenges. Now, comparatively, situation is better, but in the initial period, when we had to take a specialist, we struggled a lot. Okay. Today, though, it is better. But why those specialists are not choosing tier 2? It's one about the lifestyle, two about the academic excellence or the professional exposure. If the government also can provide the incentives for the doctors, can also give a research grant, can also tie up in the tier 2 hubs, can also tie up with the academic collaboration, international institutes, that will be very good. And the other one is about the infrastructure in a tier 2. We need to have a very, very good airport connectivity to those cities. Okay. Also, these cities probably may not be familiar with the international patient services, and the hospitality segment also may be a bit of a challenge. We have to look into those things. And because of the average revenue per occupied bed slightly lower, the gestation period may be a little longer compared to the metro hospital, but we should keep in mind that the overall cost can be managed. The other one is the healthcare in a tier 2 or a tier 3 is quite fragmented. We have large number of smaller nursing homes, but those nursing homes cannot offer tertiary quaternary care. But when we try to build something large, then we have to have the capital, we have to have the patients, we have to have the right governance. Okay, so which can really bring the cost of the down. So what the government should do, can the government do an integrated medical ecosystem in these cities? Like clearly it is mentioned in the union budget, it should have multiple. It becomes like an IT corridor. It can have everything together. Maybe in over a period of 10 years, we can have around 50 to 100,000 employment will be there. And we should also give some special incentives for attracting the doctor. How do we get the specialist doctor to these places? Can there be, like in West, when they go to remote places, the package is higher. Those centers can also be, given the additional international academic collaboration. And these hubs should have a strong medical education. These hubs, apart from the hospital, I think the primary will be medical education, your nursing college. It should have also the allied health. So this can become a self-sustaining institution. So the other one is single window. The visa, like the previous speaker talked about, we should have a fast tracking the visa. We should also give the clearance on the insurance, international insurance, we can integrate those things. But some other most important things, the choice of the location, it should be strategically looked into. It should not be politically distributed. We need to be very, very careful in the choice of the place. It should not be just equally distributed. The other one is, if we also have if you want to maintain the quality, the price regulation, price cap should be very reasonable, because otherwise it will be compromised. Okay. Now India in tier 2 cities or tier 3 cities, we have the best clinical talents, and we have the big cost advantage. We do all the procedures, what's happening in the metro cities. And if we can focus the tier 2 and tier 3 cities, and these hubs can also compete internationally, they'll become the global centers for the world. And clearly, now the next frontiers, I would strongly emphasize Next front is healthcare in India is the hubs in the tier 2 cities or tier 3 cities. Thank you very much.
Thank you for that very nice summary of the tier 2 cities potential. I'd like to call next on Dr. Harsh Mahajan, the co-chair of FICCI FICCI Health Services Committee and founder of Mahajan Imaging. Dr. Mahajan, if you could talk to us a little bit about the role of advanced diagnostics and imaging infrastructure in healthcare ecosystems.
Thank you very much, Dr. Somanathan. It's an honor to be here amongst the stalwarts of the healthcare industry. Diagnostics, as we know, is key, the backbone of healthcare. It has been estimated that 70% of all clinical decisions are based on some or other kind of diagnostic test. And hence, in setting up these hubs, it becomes very important that diagnostics be given a very important place, especially high-end diagnostics, be it in the space of pathology, lab medicine, PET CT, MRI, and of course genomics. And as we speak, we are getting newer tests, proteomics, metabolomics, which are going to make targeted treatment, precision medicine very, very important in the years to come. Now, the question in a medical value hub, travel hub, is where there is multiple hospitals are being thought of, whether it'll be collaboration between multiple hospital chains to build a very large facility, or they would be individual hospitals. That we'll come to know in the months to come. But high-end diagnostics is something where we have to reflect whether it should be within every hospital, or do we have a centralized hub, something which Dr. Devi Shetty as well as Sangeeta talked about. If we could have a centralized hub of high-end diagnostics, be it genomics, be it nuclear medicine, be it CT, MRI, high-end, then we could have multiple machines under one roof, and we could actually have what is called integrated diagnostics, a hub for integrated diagnostics, because both the physician, the treating doctor, as well as the patient is not interested in the reports themselves. They need the complete diagnosis. And this could also become a hub. And I think this would work much better than having these high-end diagnostics in every 300, 500 bed hospital. We have a large hub in the center of this medical value travel city. What this would also enable is actually being able to look at all these diagnostic tests, put them together, save the data, and use them for developing newer understandings of treatment, and also for making artificial intelligence algorithms as we go forward. At Mahajan Imaging and Labs, within our own small ecosystem, we've incubated AI healthcare, which is a platform for delivery of AI into hospitals and diagnostic hubs, which currently is the only US FDA approved and CE marked AI platform globally, being used by the Singapore government for its hospitals, being used in the US and multiple other hospitals. So just imagine the kind of data that we would be able to actually get if this was a centralized diagnostic center being fed in data by multiple elements. Then also this could be used for creating evidence for Ayush treatments, which has been alluded to just now. This same hub could be used to actually give scientific rationale to Ayush treatments recently. In fact, about a year and a half ago, along with IIT Delhi, we were able to prove that Yoga Nidra is something which it has been said to be over the centuries that even though the person is awake and follows instructions, the brain goes to sleep. And these are all possible if we collaborate. So ultimately, what I would say that we have to look at the diagnostics hub not only from the point of view of illness, but also wellness, and then teaching, training, research, and artificial intelligence, because we will have to build our own algorithms for use in our country ourselves. Thank you very much.
Thank you, Dr. Mahajan. Sir, I'd like to call on Dr. Rajiv Singhal, the FICCI Medical Value Travel Committee and founding member, the Group Managing Director and CEO of Marengo Asia Healthcare. Dr. Singhal, if you could talk to us about ensuring a seamless experience for international patients. This has come up with some of the earlier speakers as well, but from your experience, if you could share some thoughts on this. Dr. Singhal.
Yeah, thanks, Aparna. So it's easier to speak after Dr. Harsh and a lot of people because majority of the stuff has already been shared by them. But having said that, if I look at the one, I just want to pick on what Dr. Harsh has said about diagnostic is a very important component, and I'm just straight away jumping that it is not only for the sending patients to India, but the continuity of care is also equally important, and the diagnostics play a very significant role in continuity of care and monitoring, because healthcare is not transitory. It's basically built on ensuring that even after the complex procedures, especially in oncology, transplants, and other places also, you are able to monitor patients effectively. So diagnostics will be one of the cornerstones of building that hub basically. The most important point coming to how do you actually build the ecosystem where there is a transparency and there is more of a experience. I think experience comes by building an ecosystem of trust and transparency. I would say for that we have to really reach a concept where we will have fixed prices for all the patients who are coming to India, that they should understand that how the pricing mechanism works, how the markups basically work. There are no surprise elements for them if they are coming, choosing India as a destination place. So their experience on that aspect is already taken care. So I think building trust, transparency is important. And then how do you ensure that there is a concept of clinical corridor, which I have spoken multiple times in FICCI and other forums, which is teach, train, and treat. Because when you are creating these things, there has to be academics, research, and teaching and training capabilities to be built into these systems, because you will also look at pre and post operative care. When patients they come to visit India for the treatment, once they go back, the continuity of care is important. So these regional hubs should also have certain continuity of care hubs to be developed in those countries. So you are building capacity, training people, teaching people, and then you are also linking them from the complete patient care perspective. Then the experience will be seamless. That will be more science based basically travel which will take place. The most important, although we will continue to focus on building the 5 medical value travel hubs which have been highlighted by the government, which is such a welcome move where we want to position, we should start working on changing the external perception and the ecosystem, build our internal ecosystem more focused towards saying how people we should become the nation which is the most preferred nation for medical value travel in comparison to Thailand or Turkey. I think for that the active role from the tourism ministry has to be there, where we medical value travel is positioned very effectively as far as the destination, the favored destination is concerned. And I think these are the important components. Building upon trust and transparency, seamless experience will come from that. The entire door-to-door services, integrated care right from airport to airport have to be taken care. And post, once the patients have gone back to their respective countries, how they're still connected to the healthcare ecosystem, so that their later on complications and emergencies can be dealt more scientifically and clinically based. So I would say this is the way to basically build these ecosystems. I think people have spoken about The choice of circuits another. One small input, if they also be sometime thought about, there are tourism circuits which are basically exist in India, where people from various countries they come, whether they can be co-located, then the medical value travel or medical value tourism can be co-addressed in this manner. We can think about when we are choosing the destination. So these are few inputs from my side, and I think use of technology will be the most important. And technology will bring the seamless experience. Patients should not be standing in the line for the visas, for the registrations, the FRRO, all that. Basically, we have spoken multiple times. The air connectivity has to improve. People would love to travel. We know the places where there is no healthcare which exists in those countries like Fiji Islands for that matter. But the air connectivity is not direct, which actually holds back people traveling to India. So when we look at seamless experience, air travel is also one of the key components of building that kind of ecosystem. So multiple ministries have to come together to change the entire ecosystem and build India as the most preferred destination of medical value travel. Thank you once again. Thank you.
Thank you again, Dr. Singhal. So next we move on to Dr. Upasana Arora, the Managing Director of Yashoda Medicity. Dr. Arora is the chairperson for the Service Export Promotion Council and the head Medical Value Travel Quality Council of India. So Dr. Arora, from you, we would like to hear about key learnings and strategies for international patient retention. What are some nuanced approaches, such as, say, blending clinical outcomes, cultural attunement, life cycle care, that can be used for sustaining long-term trust and repeat engagement amongst international patients who are pursuing high-value medical travel in India? Dr. Arora?
Good morning, and thank you for giving me this opportunity. Actually, we are already working very hard. First of all, I would like to tell this good news that now we are going to start that portal, which was supposed to start 2 years back. So Service Export Promotion Council and FICCI, both are going to start that portal where all the patients from different countries can see the good hospitals of India who are accredited, and they can choose their doctor with their degree, their experiences, and then they can decide where they want to go. And when we talk about medical hub, as our Honorable Prime Minister already talked about, that there has to be good infrastructure, there has to be all facilities under one roof. Same time, I just want to tell you, because I was FICCI chair and I'm past president for medical value travel. So we have done a lot of work with the aviation industry also, that patients should get priority. They should not be seated and they should not come out last. They have to have preference, and they have to leave the aircraft first, because they are not well and they are coming from different long distance and all. Same time, we are trying to make green corridor for them. So patient should feel like that when he reaches to India, we should prove that it's a country of Atiti Devo Bhava. So we should greet them and we should take them seamlessly without any hassle. There has to be people on the airport who will receive them. And for that, all those facilitators who are taking patients from different countries, we are making them also accredited. They should not, anybody cannot take patients from different countries, because it's a matter of India's pride, our image in front of all the world. So it has to be Bharat image. So we are trying to make a whole journey of a patient who is coming to India for medical value travel. We are trying to reduce rates so that they should get visa in less price. Same time, we are trying to reduce wait also. So patient is sick, he should not wait for long. So all these things we are already doing, and we are just at the verge of complete all those things. Already DPIT has conducted a webinar many years back, and then that time I have given this suggestion to make help desks for the patients. And right now we are having 4 help desks in big countries. big cities. So I think this has to be everywhere where patients are coming from different countries. And we are trying to create their experience to see the incredible India. So we are involving tourist industry also, that patients attendant can see our country. It should not only that patient is getting treatment. Same time, those hospitals who are doing medical value travel, they are having Ayurveda also. So the kind of holistic healing India can provide, other countries are not having that advantage. So we should project ourselves as a holistic healing country, and wellness centers has to be promoted. So we can promote our country as illness to wellness. And I just want to share one incident with you. I am chairing this BRICS Women Healthcare Division. So lady who is from Japan, she she was sharing her experience that she was not feeling well from many years and she was having some problem. And when she reaches to India, went to Kerala, get treated there, and after that she's perfectly fine. So we should use all these testimonials who are actually coming from a very renowned people, and we can promote our country. So India can beat any country without any hassle, and we will be the Vishu Guru in medical value travel. Thank you so very much.
Thank you, Dr. Arora. We'll now move on to Dr. Joy Chakrabarty, who's the mentor of the CII Western Region, Western Region Health Panel, and Chief Operating Officer of PD Hinduja Hospital and Medical Research Center. Dr. Chakrabarty, if you could talk to us about the operational priorities for delivering high-quality hospital services. How do we ensure positive overall experience for global patients, building on what you've heard already from several of the previous speakers?
Thank you, Aparna, for asking this question. And I happen to note the kind of valuable inputs already been shared by Dr. Devi Shetty, Dr. Sangeeta Reddy, and many others. It takes me back around 22 years before I happened to travel Southeast Asia to promote medical tourism as a part of government delegation. On those days, in the global map, probably Indian medical services were honored, respected, but the medical tourism and getting patients to India was not that popular. And that time we learned something what has been mentioned by one of my earlier speaker about Singapore. They had a medical tourism board. They found by then that they wanted to, attract patients from across the globe in their own country, in their own hospitals, and they wanted to give that confidence. Now, if I take that clue of, pass visa, then talking about promoting, all this can be complemented only when you have a very good high quality product service you are going to offer. So the first thing what I feel the government as a very good move in terms of promoting this medical hub should have some sorts of promotion as a medical tourism brand of India in the international market, which can be also promoted through different, high commissions in different countries, which gives a lot of credibility and boost for this medical tourism service provider from India in the international market. Now, the second thing what you can think about, what are the other pillars, what are the other things can add more and more values. In one hand, you have the state of the art facilities. We spoke about the quality. Now, today in India, more than 1,000 hospitals are part of the NABH accreditation. Close to 100 hospitals are part of the Joint Commission International Accreditation Program. But how do you take it to the next level? How do you distinguish between different healthcare services provider? Because all of them are in the same platform, but if I'm coming from an international destination, how do I distinguish between them? So that is going to be one of the important things. So we need to have kind of our own robust grading system, which already NABH has taken up for the Indian healthcare providers. And through that, we can portray the best possible kind of categorization of hospitals to our medical tourist. The other thing what this medical hub can contribute in a significant way today, as we see the hospitals are going more and more and more in this country, but to support to work in this hospital, do we have enough number of trained experts? We spoke about doctors, nurses, we spoke about paramedical professionals, but do we have culturally equipped, developed human resources working in this hospital who can take different kinds of cultural and sociological needs when a patient reaches our hospital? How can they, manage and handle them better? So the cultural competency is going to be another area where we need to focus upon. Now, the other speaker mentioned about digitization, but I'll take it one step forward. When a patient comes from other country to India to any hospital here, one of the fear, one of the challenge they have in their mind that after my treatment, when I go back, how do I continue with this? How do I get continuous support from the hospital where I have undergone treatment? So probably we need to think of creating not a hospital-based, hospital-centric telemedicine support center, but we can think of creating through the government or maybe through other channel some sorts of center in each of the cities from where we are getting patients, where patient can come and knock and take help from those centers to get connected to the hospitals where they have undergone treatment. And that will be only possible when there is some sorts of control mechanism is there, regulatory mechanism is there from the government side to give legitimate power, legitimate license to these hospitals to promote their services in the country where they are reaching out. We have come across several stories, and I don't mind to talk about that many patients, they have landed here from the airport from different locations. They have been hijacked by a facility which may not be a very nice or state of the art facility, and they may not get the best of the possible clinical care or experience in those facilities. But due to lack of our infrastructure or monitoring mechanism of these patients, and when they land up here they are tracking, this has happened, and that has created a lot of bad names for the hospitals. The other thing is international quality and safety standards. Who should really promote their service in the international destination? So, do you really need to have JCI? Is it NABH mandatory? Or is there something else what government can ask each of these hospitals to comply with, and subsequently they can be considered as a global tourism destination? And the next is end-to-end global patient journey. What I mean by saying that is starting from lodging inquiry till they are back returned home, and post treatment care they are availing from their home. How do you ensure the entire thing is taken care of? It is needless to say that very often the hospitals in this country, they get into a price where they try to give different types of prices. Sometimes it is not very flexible. So how do we really take care and ensure that patients who are visiting here are not taken for a task that they believe, they come and they believe and they prepare themselves for a particular package, whereas they get a different kind of bill at the end of treatment. So what kind of mechanism you need to have to control those situation and those kind of experiences for these patients who are coming here? So in other way, this quality and your the kind of benchmarking what you need to create, you need to create kind of establish centers who are having enough credential to treat this international patient, good infrastructure, not only doctors and nurses, but along with that, associated workers who are trained, and create some sorts of transparent, healthy environment where they feel they are not cheated after availing treatment. So all this needs to be taken care of. Only then you can ensure a very good operational environment where you are getting giving quality care.
Thank you. Thank you, Dr. Chakraborty. We've heard quite a bit already about Ayurveda and wellness services, but now I'd like to turn to Dr. PM Bariyar, the convener for the CII Kerala Ayurveda panel, who's also the managing trustee and chief physician of Arya Vaidya Sala, Kottagam. Dr. Bariyar, we'd like to ask you about the integration of Ayurveda and wellness services within these healthcare hubs. Over to you.
Thank you, madam. I hope I am audible.
You are audible. Please go
Thank you.
ahead. Thank you.
Let me begin by expressing my sincere gratitude to the Honorable Prime Minister for his visionary leadership in enabling Ayurveda to transcend the boundaries of India. With these initiatives, India is steadily emerging as a global healthcare-led nation. The idea of establishing dedicated Ayush medical hubs or cities holds immense promise, bringing together integration, global visibility, medical value tourism, and research excellence. However, the economic journey from vision to reality is not without challenges. The first one is visa. Visa, the simplifying visa procedures. The Ayush visa, being categorized as a medical visa, often requires clearance from family physician in several countries, particularly in the US and Europe. Since Ayurveda represents a distinct medical system that many physicians there may not be familiar with, they are not often hesitant to grant such a clearance. As current regulation insists on as IU visa for the admission of foreign patients, this requirement sometimes becomes an impediment rather than a facilitator. Moreover, the Ayush visa necessitates point-to-point travel, does not encourage patients to travel within India after treatment, thereby limiting tourism opportunities. Our first suggestion would therefore not to insist on a separate Ayush visa for Ayush treatments. Allowing patients to seek treatment under a regular visa would significantly boost medical care and tourism. The other thing is standardization. Global patients expect predictable outcomes, quality certification, proper documentation, and measurable treatment parameters. It would therefore be appropriate that only NABH accredited hospitals be permitted to admit foreign patients for treatment. Otherwise, smaller facilities without adequate expertise may claim hospital status, leading to inconsistent treatment protocols and potentially affecting the credibility of the system itself. Then the scientific validation and research ecosystem. An Ayush hub must be supported by a strong research ecosystem and should not remain purely therapeutic. Robust clinical research, documentation, and outcome measurement are essential. Integration with modern healthcare systems is also important, particularly as many international patients rely on insurance supported treatment frameworks. Meeting global standards will require strengthening the human resource ecosystem. This includes ensuring quality standards across educational institutions, creating a skilled pool of therapists, training administrators and strengthening pharmacology expertise. Continuous skill development and upskilling will be critical. For Ayush medical hubs to function effectively at a global level, several elements are required. Classical documentation aligned with international protocols, then integrated case sheets and referral pathways, clear medico-legal frameworks. A clear framework for complementary care must also be established in areas such as oncology support, chronic disease management, rehabilitation, and preventive healthcare. Globally, Ayush must move beyond being perceived merely as a wellness or alternative medicine. It should be positioned and communicated as evidence-based healthcare rooted in traditional knowledge and supported by modern validation. For Ayush medical hubs to succeed, financial sustainability is essential. Such hubs require significant investments in infrastructure, research, and human resources. A public-private partnership model involving credible institutions with strong research capabilities, skill developments, and healthcare infrastructure can make this concept viable and scalable. With more than 125 years of experience and with the treatment of over 17,000 inpatients and 1.6 million outpatients annually, Ayurveda wholeheartedly applauds this visionary concept. We stand ready to extend our full support in establishing Ayurveda as a credible global healthcare solution. Once again, I thank the Honorable Prime Minister for important initiative and the Honorable Finance Minister for bringing the vision into the national agenda through budget announcement. Thank you all.
Thank you. Thank you, Dr. Variad. Moving on to Dr. Abhinav Gorakanti, who's the Director for Strategy and Network Expansion of the Yashoda Group. Dr. Gorakanti, we'd like to hear a little bit about the key factors influencing hospital network expansion and location planning, in your view.
Sure. Thank you, Madam Aparna. Thank you for this opportunity. I would like to open my statement by saying that hospitals are generational assets. Some of the best serving hospitals, which are globally renowned, are more than 100 years old. Sloan Kettering in New York is about 140 years old. Singapore General Hospital is about 200 years old. AIIMS in Delhi, which is one of our best hospital systems in that part of the region, is about 75 years old. The contrary to this is a hospital in Thailand called Bumrungrad, which is the first JCI recognized hospital in Asia, but it's only 50 years old. Thailand's healthcare journey has been similar to India's in terms of how they've grown, but our ability to brand ourselves much beyond where we currently are has not happened. So keeping in mind that these are generational assets, network expansion and location planning is probably the single most important decision for any once they set it up. This is an asset that's going to last way beyond anybody's lifetime and has to serve the society where they are for decades and generations to come. You cannot build generational assets on rented premises. You cannot build these assets at a small scale. So we believe that the hospitals that India needs to build are large format, at least in these large megapolises. The few large bets like the Cleveland Clinics or the Mayos, which are all 120, 130 years old in the US, they serve disproportionate part of their regions, and they get disproportionate name and fame, not just to their own network, but to the whole country as a whole. I do agree with some of the earlier speakers that said that it is not possible to be able to serve or run a hospital only on the basis of foreign patients. You have to be able to serve your local patients significantly more. Probably one of the most renowned hospitals in Thailand again is Bumrungrad, which primarily caters to international patients, and they don't do more than half of their entire volume for international. So serving local has to be the priority on which you can build up more for foreign patients. One of the gaps that I believe that our country can really address is that we have a lot of patients coming in from different parts of the world. They are happy with the cost, they are happy with the treatment. I think there's a large gap in our ability to service this patient post their discharge. They go back to their country, nobody can live with us for this long, which is where I think educational degree recognition between some of these different countries where we're able to train and they go back, they have certified people from India to be able to take care of them, which would really help increase our volumes. We at Yashoda in Hyderabad believe only in large format hospitals, and we've built up significant capacity in this part of the world. More than 50% of our patients come from outside of large metropolitan cities, which means patients from rural, patients from international, and patients from different parts of the country as well. So some of the key factors, in our opinion, Aparna, is that to be able to build a good hospital that's able to cater for a very long time is for you to be in a key location where there's multiple highways residential population. Air connectivity is a must, railway connectivity is a must, but the single most important thing is the availability of healthcare providers. We might be able to find demand in different parts of the country wherein there are a lot of patients that are traveling, but it's easy to build a building, but to be able to service these patients, you will need these large pool of healthcare providers where they have access to schools for their children, where they are able to have a satisfactory living for the rest of their families as well. So it becomes pertinent to be able to also assess the healthcare providers in the particular region that you would like to serve. I'd like to end my statement by saying that India needs to look at scale with a long-term vision, technology first, training next, focused in some of our large megapolises in India in order to truly cater and take a much larger market share and position ourselves as the brand ambassadors for health for a large part of this world. I'd like to close with that. Thank you so much.
Thank you. So now we move on to, I think, the third and final consultation area, where we will combine financing and investment with patient services more broadly. So starting with Dr. Somil Nagpal, the lead health specialist at the World Bank South Asia region. Dr. Nagpal, can you talk to us a little bit about global experiences and lessons in healthcare infrastructure and development? What are some opportunities for India to develop its own model that boosts medical value travel while strengthening the domestic health system?
Thank you very much, Aparna. I hope I'm audible. A lot has already been said, but to maybe reiterate that we all recognize that medical value travel is one of the fastest growing global healthcare segments, and it is expected to grow to US dollars 250 billion by 2034. And when we add wellness and holistic care, then this effective market size even doubles, underscoring the importance of integrated ecosystems that has been a recurrent theme throughout this webinar. India is very well positioned to capture a larger share of global medical value travel because of its cost advantage, its quality credentials, established international patient facilitation networks, and the strong policy momentum from the government. But we still have considerable scope to improve tourist arrivals from high spending markets by addressing some of the concerns that have been also discussed in this webinar. So if designed with some of the unique Indian advantages and policy priorities in mind, India can derive systemic gains from integrated medicities. So for example, it can create economic impact with private capital as a very large share of the financing. It can create jobs. Each medicity or each regional hub could generate between 200,000 direct to another 400,000 indirect. We are talking about 3 million jobs from 5 regional hubs up to that number. And this is a good favorable point for global investors to think of India as an investment destination with good returns coming from their Indian investments. And so enabling large scale mobilization of capital is possible at this point if the risk and the scale are, of course, rightly managed and designed. So just thinking of some global lessons, international air connectivity and really recognition for global quality, including through accreditation, emerge as some of the decisive factors for the competitiveness of medical value travel. And the preferred sites are high population regions with proximity to airports, with very good skilled workforce access. And as Abhinav was also mentioning, very strong urban amenities to really ensure that global talent feels like they can stay in that location. Co-location of clinical care with life sciences, biotech, and research ecosystem is yet another lesson. It accelerates innovation, investment, and attracts talent. If we can do better regulatory facilitation, quick plug-and-play seamless approvals, as was again coming up in the previous discussion, tax-free zones, unified regulation, expedited licensing, it can materially accelerate growth and revenues, achieve break-evens faster, and get even more investors to come in. But these will have to be well structured, and that again, a good structure reduces risk and helps faster scale. And there are some well-known models globally which demonstrate how government-backed long-term leases and support from international financial institutions was able to crowd in private capital at scale. and again complementing public investments, and then targeted public incentives. So yet another country showed that incentives that were linked to improvements in quality and use of technology adoption were effective than blanket subsidies. Of course, this has to be combined with affordable health insurance. We at the World Bank Group will be delighted to bring our complementary coordinated value to this initiative. We have our sister concern IFC, Giles will be speaking shortly, and also have MEGA. Together, we bring public sector reform, private capital mobilization, and investment risk mitigation, enabling medicities to scale faster, attract credible global investors, and deliver better financial viability and public health impact, making sure that what we are doing has a very positive spillover effect for government health systems, including improved financial access, as Dr. Shea to, along with skill development as per the message from Honorable PM at our beginning. So overall lesson is that let's look at these medicities as integrated, policy-enabled ecosystems built around specialization, scale, connectivity, and credibility. Let me close there, and thanks very much once again for my participation. Thank you.
Thank you, Dr. Nagpal. So as you mentioned, the World Bank Group also includes the International Finance Corporation. So turning to Mr. Giles Newmarch, who's a Senior Investment Officer at the International Finance Corporation, or IFC. So Mr. Newmarch, if you could talk to us about potential PPP and blended financing models for healthcare hubs. Based on global experience, what kind of support do large private capital mobilization efforts require?
Sure, thanks, Aparna. I'm just checking you can hear me?
We can hear you very well.
Excellent. And I think I'm going to speak very aligned and complementary to Sumo's points that he's just made. So I'm coming from the private sector kind of viewpoint. So with IFC, we focus on private sector investment into the emerging markets. So we spend a lot of time working with companies building their business plans, investment plans, especially in the PPP projects. So what I'm going to do here is just bring in at the beginning to lay just demonstrate, to provide some insight into some of the key areas that the private sector looks at when they're making investment decision, and then go into some of these areas of capital structure and how, from a kind of a private sector and a DFI, how we can structure projects and bring in the right type of capital to make these projects much more viable and bankable. Bearing in mind that when companies are looking at these type of investment projects, healthcare hubs, they also have competing priorities as well. So when we're looking at these investments, that we need to try and make them and structure them as best as possible, so they are competitive to other initiatives that the private sector is also considering. So companies, when they're thinking through their investments, they always look at the kind of long-term vision and the time horizons associated with the project. They look at the business demand, right? So what is the revenue model? What is the payment risk for these projects, which are kind of greenfield or have long-term timeframes? You really need to understand the ability to receive payment. What's the catchment area? What's the addressable market? Is it a blend of domestic and international customers? What's the contract length with the government? How diversified are the revenue streams? So all these different factors need to be considered from a kind of model. And then they look at the business environment, and this is something from a state and government perspective that they need to think through, and the associated sovereign risks. So how stable is the state and the country as a whole? What is the sovereign risk? Election cycles. What are the regulations? What inhibit or what encourage investment? What are the incentives there for the private sector? What are the tax rates? What's the rule of law? These are all important considerations. And then also, what's the track record of government? And what has been their behavior previously? And then the operating models. So when they're thinking about it, so how are they actually going to structure this this business, this investment to make it viable. So what's the size of the project? How is it going to scale over time? What's the human capital situation like? Are they skilled? Is there availability? What is the quality? What investments do they have to put into their employees to get them to the right level? Kind of land, the cost of land, the cost of utilities, existing infrastructure. Someone touched on where's the kind of the strategic location. Is it a good graphically for, again, the catchment area, or to make when you're looking at the revenue model, and how people are going to pay as well. That's a really important part. So these are all considerations when you're looking at large infrastructure projects that businesses think through. So we always help from an IFC perspective. We always spend a lot of time thinking about the structure and how to bring in all the different components to make this as feasible, as viable as possible, but also to help meet the various different stakeholders' agendas, which is also really important. So that make sure that there's alignment across the various different stakeholders to make sure that, again, it does work going forward. So simple way of looking at this is, as I said, there's three key from a kind of only looking at the capital structure. There's components. Government in these infrastructure projects is very, very important. I've touched on the regulations and incentives already, but guarantees is really important. And I think when we're looking at these type of PPP projects, availability payment is really important. So that's when obviously the government part pays the private sector for making the facilities available at agreed performance standards, which is really important. But that allows the private sector to have an understanding of the kind of minimum revenue and allows them to do forecasting and planning. So that really provides a stable business model as a base case, which they can then work from. And there are other, and that revenue then allows them to cover their kind of implementation, construction costs, debt servicing, operating costs, provide some investor returns. So it really helps make the project from a financial perspective much more viable. From a development finance institution like IFC, we really look at helping to shape the projects, looking at the capital structure to make it really efficient. So making sure that the right type of capital is coming in at the right time through the duration of the project. And then also, how do you shape it to de-risk it, importantly. So, IFC can provide financing products which are designed for healthcare and designed for these type of projects, so which has longer tenors. So we're talking, to meet the cash flow requirements of these, so 10 to 15 years tenures to allow these businesses to scale and ramp up to get a return on investment. Also grace periods as well. So how do you provide a kind of some capital relief, cash flow relief at the beginning of a project for 2 to 3 years until they start to make money. Also, we can look at blended finance. How do you bring in donor funding to reduce the cost of capital to make it much more affordable? It's, again, at the beginning of these type of projects. And then can bring in kind of guarantees as well, so kind of political risk guarantees, which we work very closely with our World Bank colleagues on. And then the private sector, always important. They bring in the equity, they bring in the brand, the operating capability. We make sure that they're not over leveraged, have sufficient balance sheet, and this is really important. So, if you're partnering, they need a balance sheet which is strong enough to be sustainable and make sure that they're there for the long period of time. So I think they're really the kind of three capital structures of how this can work, and how you should be, businesses should be thinking about these investments, and then how the government and DFIs like ourselves, how we look to provide financial support and commercial structuring support to make these type of projects kind of sustainable over the long term. Examples of how this has worked well in other regions. The Dubai Healthcare City is one of those. It started in 2000 and now, in 2025 has 481 facilities. including 195 clinical services, which is very impressive, and it has scaled over time. The government there really designed it so it's in a good strategic location, built the infrastructure so the kind of they had the highways near airports, near the city, so good communications, put it in a free economic zone, so favorable business environment, allowed 100% ownership, and there was zero income on import tax. So very kind of good financial incentives, good locational as well. And then the government provided regulations to demand certain levels of clinical quality, which is important. And then also they addressed it and developed global strategic partnerships to bring in brands, to bring in capability into the region, like AirMed and Cleveland Clinics. So it's just one very high level example of how this has been done successfully with a long-term vision, with the right support provided by government to incentivize the private sector to invest. I'll stop there. Thank you.
Thank you, Mr. Nimach. So we're coming towards the end of the discussions hour, but we've got two more speakers. Dr. Ritu Garg, the head of revenue at Fortis. Dr. Garg, from you, we'd like to hear about investment considerations for private healthcare providers in these emerging ecosystems.
Yeah, thank you, Aparna.
Thank you.
So the proposal to establish regional medical hubs is, of course, an important initiative. I think this would help us strengthen our ecosystem and our role in the global destination for healthcare, as create healthcare-led economic clusters that can generate high-skill employment for the country. Having said that, from the perspective of the private healthcare, the opportunity to participate in building such ecosystems is exciting and, of course, significant. But at the same time, the large-scale healthcare infrastructure investments have certain structural realities that shape how capital is deployed. I think some of these have been alluded to by previous speakers. To my mind, there are four investment considerations that become particularly important when developing new regional healthcare ecosystems. Capital sustainability, demand resilience, talent ecosystem, and innovation readiness. So, in terms of capital sustainability, we all know that healthcare infrastructure is inherently a long gestation investment. I think that understanding is there in general by the government and the industry as a whole. When we establish these kind of regional hubs, it becomes more so because people are going to come to us not for routine surgeries, but advanced clinical services, which would mean highly capital intensive technologies, robotic surgery platforms, precision oncology, emerging fields such as genomics, cellular therapies. These investments require large upfront capital and, of course, have long payback cycles. So, the most critical point becomes access to patient capital. So leveraging multilateral development institutions that we've been speaking to, like World Bank and IFC and everybody else, would obviously play a very important role in providing long tenure financing aligned with the life cycle of healthcare infrastructure. Additionally, I think fiscal neutrality or some targeted tax incentives during initial years could help accelerate private sector participation, particularly in emerging regions where demand will take time to mature. Such mechanisms can significantly improve project viability, attract global institutional capital, rather than just relying on domestic commercial debt. On terms of demand resilience, again, this was alluded to by Dr. Shetty as well earlier. I think with the geopolitical risk, entire dependence on medical value travel is a high risk strategy. We are seeing that, we saw that in COVID, we are seeing that now with Middle East conflict, the global mobility can significantly fluctuate. So for regional medical hubs to remain resilient, they should operate on a hybrid demand model. A strong domestic base should act as a utilization anchor, ensuring there's a steady demand for high-end clinical infrastructure. International patients can, of course, would be the center and complement the ecosystem and support investments. The balance model thus would provide commercial stability and global competitiveness. Another very important factor is talent. We can build state-of-the-art medical facility, but attracting high caliber clinicians, researchers, healthcare professionals require much more than hospital infrastructure. What enables talent migration is a complete 360-degree livable ecosystem. So government and private sector will have to collaborate not only on healthcare infrastructure, but on social infrastructure. So quality housing, international standard schooling, safety, security frameworks in that ecosystem would be very important to make it sustainable for talent to be housed there to serve the patients from India and otherwise. If healthcare professionals and families are provided with a world-class living environment, we will not only be able to retain talent, but also actually begin to reverse the brain drain, encouraging leading Indian clinicians working globally to return and lead these centers of excellence. One fourth point is innovation readiness. So, regional medical hubs can provide an opportunity to build integrated medtech and life sciences ecosystem alongside clinical infrastructure. Today, India is dependent on imports of high-end medical technology. While there is a push with Make in India and our indigenous production happening, but if these hubs are designed with research partnerships, clinical testing platforms, and innovation clusters, they can become a powerful engine for indigenous healthcare innovation. And that would fuel the private investment as well. Equally important would be to design these as digital first healthcare ecosystem. So remote monitoring system, tele-ICU capabilities, integrated data health platforms should be embedded from the design stage itself. That would allow clinical expertise to extend beyond the physical boundaries of hospitals and strengthen the healthcare delivery across wider regions. As we say, heal from India, heal by India. If these investment conditions are aligned, the regional medical hubs can evolve into something much more powerful. They can become our answer to global medical clusters where clinical excellence, research, wellness tourism can create and converge to a self-sustaining ecosystem. You have seen these examples in Dubai, even in Turkey, Ankara Blanket Hospital. They've built these ecosystems through public-private collaboration. And from the perspective of private healthcare providers such as Fortis and others, there is definitely a strong interest in partnering with the government in developing these next generation healthcare ecosystem.
Thank you, Dr. Garg, for raising several important points, the digital innovation and so on. And finally, Mr. Anas Wajid, who is a former chair and chief sales and marketing officer of NACS. Mr. Wajid, if you can talk to us about the importance of international patient outreach and coordination of services.
Good afternoon, Dr. Parna, and thank you for this opportunity for the conversation today. Am I audible? Am I audible to everyone? Okay. So let me just sort of stick to the medical value travel part of the discussion that we're having, and we heard a lot of people since morning. I'm going to make just 5 points really, which truly impact and how we drive medical value travel. We are one of the largest players in this space and we do it all the time, but I think there's some points where we need greater support and some policy matters as well. So point number 1 really is, from an India's point of view, we need to look at how do we diversify our source markets. So most of the hospitals in India are getting patients from certain belts like East Africa, in speaking parts of Eastern Africa, some countries in West Africa, a few from the Francophone parts of Africa. We're getting patients from Central Asia, we're getting some patients from Southeast Asia. Pretty much that's what we do today. So therefore, we need to diversify our source markets. We need to look at other markets, particularly those in the Western world. We need to look at Eastern Europe, perhaps. And there are opportunities in all these markets. Therefore, we need to sort of diversify and look at these markets. Now, what do we need to do there? And therefore, I think we need to, at an institutional level, participate in more roadshows, tourism events, institutional business opportunities in these markets need to be explored. And therefore, I think that makes a compelling sort of case for diversifying. That's one. I think most importantly, we need to look at global branding of India as a global hub for medical value travel. That's extremely important because today what is happening is that private hospitals in their own sort of constraints have been marketing themselves, competing with each other as well. But there is no unified campaign or global branding that we have done so far for India to be established as a medical value travel hub. I think we need to have policies oriented to this. We need budgets, etc. We need financial support to be able to brand and position India, the country, as a great medical value travel hub. We offer literally everything from world-class medical services to great hospitality, all of that. We are the pharmacy to the world as well, and we are probably 25-30% of the cost. And therefore, we need to position India as a global branding hub. That's essential. That's point number 2. Moving on to point number 3, I think what we also need to do is improve our medical travel experience. So others have spoken about things like faster visas. We need a great portal. I think Upasana ji spoke about SCPC doing something about it. But today, unfortunately, the reality is that for many patients who are traveling to India, this remains a leap of faith. And therefore, we need to correct this, ensure that correct, accurate information is available in a timely manner for people who are wanting to travel to India. We need to improve facilities at the airport. We need to basically improve the entire chain that's involved in taking care of patients and delivering a great experience when they are in India, not only hospitals, but everyone else. So that's my point number 3. Point number 4 really is that in today's world, we have to do many things when you're reaching out to the globe, and digital healthcare has got to play a very, very critical and important role in this space. So I mentioned we need this great information portal, completely neutral, which features multiple hospitals, and has information which allows patients to take informed decisions. We need to look at a robust mechanism for telemedicine consultations for patients who are abroad and want to sort of consult with their doctors over lines, and then make up their mind. And of course, there's got to be some mechanism for post-treatment follow-ups on a digital backbone. Therefore, we need to create a digital ecosystem which allows patients to reach out to Indian doctors, to hospitals, to other people who they need to as securely as possible. That was point number 4. And finally, point number 5, I think we need financing models, which are extremely important. While we've said that India remains one of the least expensive destinations for quality health, many people coming from many parts of the world still sort of find funding their travel quite difficult. Therefore, we need to establish insurance-related partnerships with global insurers. At least the leading hospitals or all those who aspire to participate in medical value travel must create these partnerships. Therefore, patients can avail of cashless services at these hospitals. And in my view, also, we need to have some kind of insurance cover or policy for follow-up care when they go back home. So what happens if I develop some complications? Who is going to take care of me, assuming that services are available? Therefore, in the local sort of countries, then is there or can there be an insurance cover which takes care of these sort of unexpected outcomes? So these are the 5 points that I thought I'll try to make in a very concise sort of discussion, ma'am. And I do believe that these are things that we need to take up at policy level, at execution level, at various levels, etc., to help MVT grow in India. So thank you for this opportunity, and thank you for listening to me patiently. Thank you.
Thank you very much for that. That brings us to the end of our panelists. I'd like to ask some of the others who are still connected, maybe Dr. Rajib Sen or Dr. Mahajan, if there's anything that you heard that you'd like to comment on, or anything else that you'd like to say, or anyone else who's still connected and who'd like to add. Any comments?
Dr. Mahajan, please go ahead. Please
No,
go
please,
ahead.
please, I'll follow you.
Yeah. So no, nothing much. We had a lot of discussions. I think on all this, we need to come up with a proper strategy. For instance, first is, as was mentioned by several of you, the facilities that need to be put in place and how do we do it. The financing part, of course, also came in because I would consider the financing part to be the most difficult, because whenever you talk of blended finance and things like that, these are not easy to come, and there are a lot of competing demands for this. So how do we prove to the world that this would be a model which would be successful, sustainable, and long term? So I think this is only the first stage, but we need to work together. And from the Niti Aayog side, led by our CEO and honorable member, we would be very much interested to have stakeholder consultations with, and of course, Ministry of Health is always there to come out with a strategy and ensure that, and I know it is not one ministry, it is spread across several ministries. Ayush is there, tourism is there, DPIT of course is there. So how to get an integrated structure, I think, is the first challenge that we need to overcome. And then of course, having set the structure, how to get the finances right. So again, these are very broad thoughts, and I'm sure many of you would be able to contribute in a more holistic manner. So thank you very much. And then I would request others also to pitch in with any points that they have.
Thank you, Dr. Rajiv Sen. Others, please pitch in.
Yeah, I have Madam, please go
on. Aparna, if that's okay, if I may quickly add that, it's very exciting what we're discussing, and we must find a way to do it in a successful manner, and lots of really good points have been expressed. I would request that in parallel, the track of identification of existing good facilities and the creation of the marketing net and the infrastructure be put in place, because over a period of time, the other countries or other destinations are getting preference, and therefore we shouldn't lose out in our ranking in the medical value travel. Then the Medicities become additional hubs and will accelerate this journey even further. But if we wait for 2 or 3 years before these come up, because you can't market in a vacuum. So we need to establish the capability, build the India medical value travel brand, and in parallel build the hubs. Would be one of the points I'd request to be treated as a parallel stream in this really important initiative, because you're coalescing so many good minds and so much infrastructure in terms of the various departments. So this is my request, that if we can treat this as an immediate and parallel stream, which is a critical building block for the success of this project.
Thank you, Dr. Reddy, on that important point on sequencing. Anybody else?
Yeah. So Aparna, the document says, or even during discussion, the hospital will be managed. For example, the oncology or a cardiology or some other department will be managed by multiple stakeholders. I think it may be a very challenging one in practice. Ideally, each hospital should be led and completely run by one particular the brand. Because the moment they start working multiple, there'll be a day-to-day coordination issues. That I thought specifically I should highlight that point.
So I would like to echo what Dr. Sangeeta Reddy just said. Building new infrastructure, especially hospitals, at the very least is going to be 4 to 5 years, even if we are able to find the money for building it. So I think we need to leverage what we have today. And these medical value hubs, to begin with, can come in with maybe step down, facilities where someone having undergone a surgery in a hospital, then instead of spending 7 days there, comes after 3 days to this step down facility, while the newer hospitals are being built. We could of course have wellness that could start pretty quickly. Diagnostics could start pretty quickly, but the hospital part may actually take time. And to Dr. Sangeeta point that we will lose out in these intervening years. We would still be doing what we are doing today. Second, I think everyone has emphasized the point that just medical value travel patients alone may not be able to, give us a steady stream so as to stay above break-even levels. And so one would have to look at mixing of patients from within the country with those who come from outside, because most of these are going to be tertiary and quaternary care centers in any case. So these are two things that come to mind. I think the digital systems should be uniform across different hospitals so that we are able to collate data and build something out of it going forward. Thank you.
Thank you, Dr. Mahajan, and many thanks to all the speakers. So this was an extremely rich discussion. I see there are two more hands. I'd like to ask you if we have time to take two more comments.
2 points just I would like to add here. So when we say medical value travel, most of the time we focus on the illness and chronic ailments like that. So Ayush system, as we all know, that it is not only focusing on the ailments, even it will helps to preserve and promote the health, and even it will help to prevent the lots of disorders. So even we need to focus on this part. So whenever the patient comes, so even we need to recommend them that you need to go for this kind of preventive procedures. And moreover that when we say like chronic ailments, nowadays we are able to see that many allopathy or modern medicine hospitals, they're referring numerous patients to the Ayush institutes, especially for the managing chronic disorders. It may be the patient on any chemotherapy, radiotherapy. So ultimately to improve the quality of life, so they are referring the patients. So here, what I want to say is that, so when the patient will comes for these kind of things, ultimately the stay of the patients will be for more than 4 weeks, or it may be go up to the 2-3 months. At that time, the companion who is coming with the patient, or any attendant who is coming with the patient, so can we cater some skill based training course? Suppose if I want to say like wellness yoga instructor or yoga therapy assistant, so these are all limited hours trainings are there, because this will help to make a huge pool of caregivers. So this is from my side. Just I want to add here.
Great, thank you. There are two attendees who've raised their hands. I would like to see if maybe Milan Mehta could speak. Would you like to unmute and speak? It's possible that, oh, okay.
I think Aparna, you can conclude now.
All right. There were a few questions from attendees, but I don't think they can unmute the way the thing is set up. So I will make some.
They can still unmute. These cannot. Attendees, okay, attendees as in the people who are as passive
Yes.
participants.
Yeah.
No, they can't. But if there is any question which you or any of the panelists would like to take, I think that can be done.
Right. So there was a question on the sequencing of sort of infrastructure coming in parallel and so on. I don't know if Giles Newmarch from IC can talk a little bit about this. Also, there was a question about ownership of the hospitals that maybe Dr. Nagpal could take, if that's possible, or anyone else.
Maybe very quickly, Aparna, if I'm audible, I think the ownership part is quite clear from the announcement of the budget that this is expected to be mobilizing private capital and attracting global investors, while of course there will be substantial infrastructure development from the public side and maybe some financing models from the public side that would encourage such investments. But the very essence of being able to utilize private capital in a good way that attains public priority objectives. So models will have to be accordingly tweaked so that the ownership or the lease structure can provide the viability of long-term asset ownership by the investors. So I think this needs to be really worked out in more detail with more consultation, but it's a very important point, and recognizing that it has to be a viable model for the private investors while ensuring that it achieves all the priority objectives from the public sector as well. Thanks very much.
Thank you. If there are no further comments or questions, so unfortunately, attendees were unable to take your questions right now, but feel free to put your questions in the chat box and perhaps we can respond later. So it was a very rich discussion. A lot of really good ideas were raised. I'm going to try and summarize them, but I think it would be good to unpack these ideas over the next few weeks and months. So to start with, regional medical value travel hubs must be seen as integrated ecosystems. They bring together clinical care, advanced diagnostics, education, research, Ayush, wellness, rehabilitation, biotech, hospitality, and end-to-end patient facilitation. Secondly, high-quality, accessible domestic healthcare delivery, that is, healthcare delivery for the population in India, is the foundation of global credibility. Strong local volumes can anchor utilization. It can drive clinical excellence, ensure financial sustainability, and build international trust. And medical value travel should build on this base. Third, Tier 2 cities also represent an important opportunity. With existing unmet demand, lower costs, reduced congestion in metros, and the potential to deliver world-class tertiary and quaternary care when supported by the right ecosystem. Government leadership is decisive, is critical. The political intent, when we heard Prime Minister Modi this morning, the enabling policy frameworks, land availability, connectivity infrastructure, and long-term regional planning will determine the success of all of this. Public-private partnerships are essential. For that, we need clear governance structures, special purpose vehicles, transparent financing mechanisms, and outcome-linked key performance indicators will be critical. Then, we have access to long-term patient capital. This is going to be a key defining success factor. Advanced clinical services, robotics, precision oncology, genomics, cellular therapies, all of these are highly capital intensive, but with long cycles, hence the need for patient capital. Multilateral development institutions, the World Bank, IFC, and others, can play a catalytic role by providing long tenure financing, risk mitigation instruments, and crowding in global institutional capital aligned with healthcare infrastructure life cycles. At the same time, targeted fiscal initiatives or tax neutrality in the early years can significantly improve project viability and accelerate private sector participation, especially in emerging regions where demand can take time to mature. Shared, centralized infrastructure improves efficiency and returns, particularly for high-cost assets such as advanced diagnostics, nuclear medicines, genomics, precision therapies, research platforms, and skill development facilities. And diagnostics are a core pillar. They're not just a support function. They enable clinical decision-making. They enable clinical decision-making, AI and data-driven care, research, precision medicines, and scientific validation of Ayush therapies, for instance. Over the years, especially in recent years, India's healthcare value proposition has evolved from being a low-cost care center to cutting-edge, high-end clinical excellence across oncology, cardiac sciences, transplants. And this strength now needs stronger global signaling. Ayush integration is a unique Indian advantage, particularly when backed by diagnostics, research, and globally understandable outcome metrics. So global positioning of this high-quality healthcare will require a coordinated national effort. We would need credible digital portals, transparent information, reduced dependence on intermediaries, strong government-led branding, and alignment with tourism and aviation. Ease of access and seamless patient experiences matter as much as clinical quality. We talked quite a lot about medical visas today, the speed of processing, airport facilitation, predictable pricing, end-to-end patient navigation, and the continuity of care after return home will strongly influence India as a destination choice. The resilience of demand, once we've established it, will require a hybrid model. A strong domestic patient base should act as a utilization anchor, with international patients complementing growth and improving global competitiveness. Then there's talent attraction, attracting strong talent, healthcare workers. All of this depends on livable ecosystem, not just hospitals, but quality housing, international standard schools, safety, social infrastructure. All of these are essential to reach talent and reverse the brain drain. Innovation readiness must be embedded from the outset. So co-locating clinical care with medtech, life sciences, research partnerships, and clinical testing platforms. All of these can drive indigenous innovation and reduce import dependence. A digital-first design is non-negotiable. Tele-ICUs, remote monitoring, integrated health data platforms, and AI should be embedded from the design stage to extend expertise beyond the physical facilities. Skilling is a central outcome, especially advanced nursing, paramedical and allied health training, subspecialization, cultural competence, global recognition of credentials. So all of these are really important points that were brought in the discussion today, that were expanded on by speakers who know a lot about this issue and who have a lot to offer. So healthcare must be viewed as a socioeconomic and diplomatic engine, captured in the integrated vision of Heal in India, by India, and Heal from India. Thank you all so much for all your excellent comments and contributions today. It's been a real pleasure to be part of this panel and to hear from all of you. And I look forward to taking this forward with all of you in future. Thank you.
Thank you, everyone. This is again DC. I would also request, guys, there would be session where between 3:35 to 4, where Dr. V.K. Paul shall be summarizing the overall discussions that have been done in all the health related things. After that, there would be remarks from the concerned ministers, that is Union Health and Skills and Commerce and Industry. So I request all panelists to be there if their schedule permits.
Thank you very much.
Thank you all very much. Aparna, wonderful to hear your amazing summary. Thank you.
Thank you all.
Thank you. Bye-bye.
Thank
Thanks,
you.
everyone.
Thanks.